I'm
We're with
great.
great. We're with Steph Montgomery, who's a longtime Fed is Best advocate, and I'm here to see what she thinks about the book, as well as the whole Fed is Best movement and her experience as a mom.
Great. Well, so for one, the book is so fabulous. I actually cried. I was discharged from the hospital with a newborn, first time mom, but I was very well informed. Had been working in public health and women's health for a really long time. Was very committed to breastfeeding. Was not provided with much information at all about how to know if your baby's getting enough. I had a different book. I had The Womanly Art of Breastfeeding.
So did I.
Yeah, not a good book. So I remember being at home, day 2, with my newborn, topless, sitting on my bed. So I had my laptop. I had The Womanly Art of Breastfeeding. I had a baby that was either screaming or sleeping. And had to be attached to my boob at all times. And I didn't know what to do. And I remember thinking there has to be something in this book about what I'm supposed to be doing now. And it just kept saying, feed the baby, feed the baby. I called a lactation consultant at the hospital. Again, they were like, oh, just keep doing what you're doing. I called the La Leche League and they said, just don't give the baby a bottle, whatever you do. By the time we went in to see the lactation consultant in person, she had lost a little bit of weight. We didn't know that anything was wrong health-wise. They just kept saying, you can supplement with formula. That's fine. But here's this SNS, a supplemental nursing system. We want you to triple feed. So we want you to feed the baby both sides. We want you to give the baby formula through the SNS. We want you to pump. And then we want you to do that every 2 hours into perpetuity. I had no idea what I was doing. And so I believed this nurse, this RN, lactation consultant. I was like, I'm going to do this and I'm going to breastfeed my baby because everything that I've been taught was breast is best, formula is inferior and dangerous, and you can't choose formula unless you're a bad mom. When we left the lactation consultant, we made an appointment to come back the next day. We came back and our child has still lost weight, and then they sent us in for a bilirubin test. And their bilirubin was 21. And now that I know what that means, I'm like shocked that that could happen. And we would interact with all of these medical professionals and they would all say everything's fine. And they got that report back from the lab. They said take them to the emergency room. And so we did. They were admitted having lost 20% of their body weight, their birth weight. I thought I had completely failed as a parent. And I remember trusting this book that I had, this breastfeeding book, to tell me what I needed to do to breastfeed exclusively, to feed my child, for my child to be healthy, how to be a good mom. And it absolutely did not have that information. And so when I read this book and then saw that not only is it a analysis of the history of infant feeding, like, my gosh, Christy, you should be so proud.
Thank you.
The history of infant feeding, the medical knowledge that I think every parent needs to know about their baby and about what happens after birth to their baby, and about how feeding can go well and about how feeding can go catastrophically bad. But then the practical information that's inclusive. I have never read the words combo feeding in a parenting book. I have never seen a parenting book say the words formula is a safe feeding choice. In fact, everything that I've seen about infant feeding, whether it's been a brochure from the hospital, and I've delivered 3 babies and I've gotten 3 different sets of information from Baby Friendly Hospital Initiative hospitals, and they all have said things like formula puts your child at risk for SIDS. Formula puts your child at risk for obesity. Formula causes asthma. all the myths that
Everything.
you dispel in the first half of this book, but then going on to honor the choice, to honor individual families deciding what works for them. It's so meaningful. Can't tell you how important this is to read. And we as a culture treat women poorly, period.
Yes.
And then we treat women who become like they're completely incapable of understanding medical information, completely incapable of understanding how to make a choice, how to review evidence, how to be the best moms that they can. And for me, this is such a feminist issue.
It is.
Because when we treat women like, and other people who birth babies, like they are not smart enough or capable enough to make the right choice for their family, it's infantilizing. It's misogynistic. And it has become this language of parenting education where new parents are treated as if they don't know what they're doing. And as a result, they don't know what they're doing. So just reading this book, in fact, when I first read it, I was like, oh, wow, this is at a really high level. I appreciate all of the sources being cited. I appreciate all of the medical literature. And I realized that part of that is twofold. Part is that you feel as if you have to cite all of your sources because this message is so new. And reading this book was really affirming for me. As someone who wasn't diagnosed with insufficient glandular tissue until after my second baby was born and we had supply issues, as someone who was, you know this about me, but as someone who's fought against that awful statistic that only 5% of people can't breastfeed, and digging
Show me
deep.
the study.
Well, there is no study. It's a quote
there is no
of a
study
quote of a quote. It's
of a
like
quote of
a game of telephone with bad
That's
science.
exactly right. That's exactly right.
So to read other people's stories, affirming, but then also understand the science. There's no other thing that your body does that we expect everybody to be able to do with perfection, perfect efficacy every time. There would be no diabetes. There would be no heart disease. There, and yet we treat women again. It's this misogyny in our medical system and our healthcare system, and we tell women, "Oh, well, you just need to try harder." And so when you're working within systems that are inherently misogynistic, systems that don't trust women to make the right choices for their bodies and for their babies and their families, and then you provide really substandard information how to do it, it's not natural. Like, I remember reading The Womanly Art of Breastfeeding and thinking, I'm going to do this. This is the most natural thing in the world. And not even thinking for a second that I would have an issue or a problem because I was committed. And I watched videos, I took breastfeeding classes. I thought I had it handled. But, I think, again, this is the expectations for mothers are so high. Like they have to be superhuman. They have to both be confident, educated, and compliant. All right.
Yes,
they have to both have all of the knowledge, skills, abilities, support systems, work-life balance situations necessary to have all of this happen. And they're expected to do everything perfectly. And then when something goes wrong, because something always goes wrong, then they feel like they're a failure, like it's their fault. I think the more that we can provide women and other prospective parents with information, not just that there are other legitimate feeding choices available, that they can be supported in making choices about infant feeding. They can be supported in safely breastfeeding their babies and they can be supported in doing all of that. And if it doesn't work, if for some reason supply, delayed supply, their work situation, their family situation, if for some reason it doesn't work, that's okay. Reading the section on formula prep, I remember making my first bottle of formula and I cried. And I thought for sure I was going to do it wrong. And I thought it was dangerous and I thought it was bad. But not only that, I really didn't know anything beyond what was on the side of the can about how to make a bottle. And then you're doing it when you're tired and helpless and your baby is crying and hungry. And the idea that we don't provide moms with information about how to formula feed. It's almost just assuming that nobody would make that choice or
need that choice.
Yes. I can't tell you how much I appreciate reading a parenting book that not only is informative and comprehensive and inclusive, but it doesn't treat me like I'm dumb. And it assumes that I have choices available to me. It assumes that I can read medical research, and it's also approachable. It's not too high level so that people that do have a lower reading level can't understand, but it makes all of that information really approachable and really available in an easy format. I think that you need an app next.
We need an app next. We need a course. We need an app. We need resources. Maybe Melinda Gates will give us some resources to make that.
Definitely.
I hear that she's leaving Gates Foundation and creating a Women and Children's Foundation.
Oh, I love it.
She hears this.
Hopefully. But no, I mean, no new mom should be sitting in a bed topless, trying to figure out breastfeeding alone. No new mom should have a sick baby and not know their baby is sick.
Right.
Because everyone says, oh, you're doing fine. It's weight loss is normal. I'm going to cry. So I don't know if you've seen it, but I was watching old reruns of Law and Order. And there's a Law and Order. So I'm going to send you a link. There's a Law and Order episode where a mom accidentally starves her child. What? I'm going to cry. The prosecutor, and she's charged. It's hard. It's heavy.
I know. Steph, it's real life. Yes, go ahead.
The prosecutor said, how could you not know that your baby was losing weight? And I can tell you, I sat in my bedroom with my newborn, and you can't tell. You're with them 24/7. You can't tell these minor changes in their weight, in their skin color. And then the resources that are available are like, count diapers. I'm like, this is a wet diaper, right?
Right? Oh, well, it's like it has a teaspoon in it.
Yeah. The line is blue.
Line of blue. I did the same thing. The line of blue. That is the most dangerous diaper innovation ever, because that is not a wet diaper just because the blue line is there.
Right.
Oh my gosh.
And then no one should have to feel helpless in these moments where they deserve to feel competent and confident in becoming a mother. For me, breastfeeding was not the most natural thing in the world. And I did go on to breastfeed my son. I had an amazing lactation consultant who's also a physician who said to me, hey, here's this study, and your breasts kind of look like the breasts in these photos, the IGT study.
Yes.
And I looked at the pictures and I was like, oh,
holy crap.
My gosh.
Yeah.
Like she said, you know what? You're probably not going to be able to exclusively breastfeed. And I was sad. And she's like, but wait, you can still breastfeed. And I'm here to support you. And like, we can do this whatever way you want. And I remember saying anything but triple feeding.
Oh, yes. I'm glad you did. I'm glad you did. Goodness.
Christy, I triple fed Kai for 3 months because the lactation consultant didn't tell me when I could stop. And I thought that I had to continue until I knew that they were getting enough. Like, I don't even know why it's a thing. It's just torture. But to have a healthcare provider say to me, you can feed both breast
Mhm.
milk and formula. You can do it for as long as you want or as little as you want. We can get you set up with a hospital grade pump, but if you don't want to pump, that's cool too. And to tell me about power pumping, to tell me about
Mm.
IGT, and low supply and how common it was. I remember she runs a nonprofit here in Lincoln and then also in Omaha, and it's all
Mhm.
breastfeeding support services on a sliding fee
Mhm.
scale,
Mhm.
and it's all evidence-based,
Awesome.
non-judgmental.
Awesome.
And she told me that 70% of her patients have low supply issues. And then when reading the research and again, talking about misogyny, like when women say, I had low supply and that's why I stopped, and they're treated
Mhm.
like that's a poor excuse or they were lying,
Right.
um,
Right.
as if
Right.
we
Or
don't
you're
know.
yeah. Right.
Um,
And you weren't informed. You were mistaken. That's all over, peer-reviewed literature. That's the language that women are that are that's used to describe women's description of low milk supply.
Women's description of what's going on in their own bodies and with their own babies that they're
Mm-hmm.
fully aware of. They're
Yep.
fully aware that baby hasn't pooped in 5 days. They're fully
Mm-hmm.
aware the baby is losing weight once they find out what the weight is. They're
Mm-hmm.
fully aware that the pediatrician is like, hey, you should supplement with formula. But then they're like, wow, I can't be this rare person
Right.
because I try really hard and I educated myself and I'm
Mm-hmm.
committed to this. But we wouldn't say to someone who had committed to running a marathon, then broke their ankle, that they didn't try hard enough to complete their marathon. We would say, "Oh, so your ankle hurts."
We
We
believe
believe
that.
we believe them. Yeah, I think it's super important not to treat women like they don't understand what their bodies do and what their bodies don't
Yeah.
do. I think
Yeah.
it's super important that we don't prioritize breastfeeding over mother's well-being.
Yeah.
I think it's super important that we allow people to identify their own goals. The pressure to breastfeed exclusively had such a dramatic impact on my mental health at a time
Mm-hmm.
when I was already fragile. Then, when that pressure was released, when I was able to combo feed my son and not worry
Mm-hmm.
about how much breast milk he was getting because I was supplementing with formula, it
Mm-hmm.
really made that experience of motherhood so much more powerful, and I was so much more confident in my abilities and in myself, in my own choices. And so
Mm-hmm.
to see a baby thrive getting both formula and breast milk is amazing. And the idea that we don't want to tell women and other people who birth babies that breastfeeding is hard or share with them the risks of breastfeeding because
Mm-hmm.
then they won't want to do it is
Mm-hmm.
just infantilizing,
Mm-hmm.
just
Yeah. Yeah.
misogynistic.
Yeah.
Women deserve to get all of the information and then to make their own choice.
Absolutely. I mean, the fact that even health professionals are being put in this position where people who actually have the training required to understand are being told these infantilizing things, these completely non-scientifically true things like the newborn stomach is tiny, that low milk supply is rare, that colostrum is always enough for all babies, and that crying and nonstop nursing are not signs of hunger when they are. And at the expense of babies who are going to suffer the permanent consequences of such negligent advice.
Absolutely. I remember reading the brochure in the hospital after giving birth about what to do when you go home. And there was a whole page and it was booby traps, which
Oh,
I
yes.
know, right? How
Yeah, I know
infantilizing is
that.
that?
I know that.
And it was the first thing was don't give a bottle, just keep nursing, don't worry. And the stomach, the size of a marble walnut, which we all know is not true now.
We
Now,
know.
everyone deserves to know that. But
Yeah.
my heart just breaks when I think about crying hungry babies whose mothers think that they're doing the right thing and think that all babies have an awful second night of life. and that crying and screaming unless they're attached to a boob is completely normal, that breastfeeding the whole night through is completely normal. When they question what's happening because they don't think it's right, like, hey, is this normal that my baby is crying, or is there something wrong? Then they're almost gaslit into continuing along this same harmful path when their instincts are to feed the baby and to comfort the baby. And so my heart just breaks when I think about those early days of Kai's life, not knowing that he was hungry, but then also the fact that every single medical provider that I talked with told me I was doing great. This medical gaslighting of women has to stop. We deserve all of the information to make the right choice, and that have a comprehensive guide to feeding our babies that's inclusive of all of the information and doesn't immediately demonize formula, immediately cite statistics that don't exist about the dangers of formula, so that women like you and I are afraid.
Yeah, we believe those resources. I mean, they
Well,
come from supposedly reputable sources, and the biggest one being the World Health Organization. And to this day, you can look at the WHO web, and it says exclusive breastfeeding from birth to 6 months provides all the nutritional needs of your baby. Period. No explanation, no asterisk, nothing to say to account for all the women, birthing parents on this planet for which that is absolutely not true. And it's just, yeah.
So even if only 5% of women and other people who attempt to breastfeed can't, that's not a small number.
No, that's millions of people, millions of children that are put at risk.
And we know that there's also a whole host of reasons why breastfeeding might not be the right choice or might not be possible for a specific person. And so we know all of that, but the message is still black and white. And that's where we go wrong. It's not only insulting and wrong, but it's dangerous.
It is. It is. It's absolutely dangerous. I remember having conversations with moms. You think they have it all together. They have no reason to be suffering. And then they tell me there was a time when I legitimately thought it would be better for myself to run my car off this bridge than to go back home to my family because I can't breastfeed. Someone said that to me. She was the most vivacious, funny woman, smart woman that I knew. And she said that to me. What have we done?
Not only do we get these messages from healthcare providers who we give so much trust to give us accurate information so we can make really informed choices, but our culture has shifted so that everyone talks about breastfeeding if it's easy, possible for everyone, and then come to find out, everyone has challenges, whether it's oversupply, whether it's pain, but we're encouraged not to talk about any breastfeeding. We're encouraged to smile, enjoy every moment of this very complicated thing that you cannot teach someone before they have a baby, and then that baby is dependent on that for survival.
Yeah. No, it's true. And then the whole bias that if you say anything negative breastfeeding, or if you say anything positive about formula, you are anti-breastfeeding.
How many times we babysat for friends and family. Like, we are sent off into the world with a whole host of misconceptions and then a set of expectations that may or may not be possible, and just not knowing that if something goes wrong, it's not your fault. And then also being told to put aside your own health, your own well-being, because you have to sacrifice in order to be a good parent. And there are so many people out there that are suffering needlessly. And then in turn, their babies are suffering as well. Every time I read a story about a baby that's failure to thrive. I cry a little, but when you're reading these, and I'm not blaming the mothers at all, because
Yeah, of course.
I know that this is our culture, this is our medical system, this is our activism, this is our breast is best fee.
Right.
Reading about a mom taking her baby to the doctor every week for 6 weeks and having the baby only gain half an ounce in that time,
I know.
and then
I
you're
know.
like, and then they continue to breastfeed, and heart just breaks, Christy.
Me too. I can't think of more heart-wrenching issue on this planet. I mean, yes, there are really bad issues. Bad things are happening in the world, but something so simple and something that we were wired to do well, which is to feed our babies and find whatever by any means necessary. We are unnecessarily exposing mothers and babies' parents to not only dangerous conditions, but just inhumane conditions. Just absolutely inhumane conditions to serve a global health policy target that I don't know came from who, you know what I mean? I mean, a health policy should serve the needs of the population that it was created for, not the other way around. It seems like we have evolved to where people are at the service of the WHO target. That's it. And it doesn't matter who gets harmed, doesn't matter how many families are put in how many babies are put in the hospital, or how many women experience postpartum mental health problems. WHO continues to bemoan our inability to comply with their guidelines.
And not actually looking at the reality of infant feeding for mothers and other people who birth babies when developing policy is just really short-sighted. We have this goal of exclusive breastfeeding for 6 months, period. Well, that misses the mark when it comes to paid family leave policies. It totally misses the mark when it comes to supporting pumping in the workplace, support adequate family and medical leave. I read a statistic, this was a couple years ago, that in the US, 25% of moms go back to work 2 weeks or less, 2 weeks or fewer.
Yes.
And so how can you exclusively breastfeed? How can you possibly be successful? And then just looking at the world globally, I'm not going to dismiss the horrible things that Nestle did in the less developed world. But having lived in an African country, I can tell you that the women there are just as capable of feeding their babies as we are.
That's right.
It's so
That's right.
It drives me bonkers to hear the mainly white women talking about how formula is pushed on women in the less developed world, and then how they're not educated, they don't know. When in fact, having to safe formula might be life-changing for people in the less developed world, just in terms of the ability to work and be independent. But I say all of this not to say that breastfeeding is bad.
Of course not.
Love breastfeeding. I want to support every person in feeding their child the best way and the most healthy way imaginable for them, for the baby. And I want babies to be safe in their first days of life. I want all moms to feel supported and to understand that there's just a vast spectrum of different situations where different feeding methods are appropriate and the best,
Yes. Thank you so much, Steph.